Let's discuss heart imbalances pathology, still under diagnosis according to Zhang Fu organ patterns. When the heart is imbalanced, this can manifest with changes in both its physical function, such as heartbeat, and how the Shen is manifesting. The heart is the most yang organ in the body, and the Shen is the most yang aspect of the body's qi. This means that the heart, and in particular the Shen, are very sensitive to pathogenic heat due to its yang nature. On the physical level, heat will overactivate the heart, causing it to beat faster. This can manifest with palpitations and a rapid pulse. It is perhaps important to point out here that palpitations in Chinese medicine means the subjective sensation that the physical heart is beating stronger and faster than normal. If the heart is in balance, you are not aware of the heartbeat. It is not something you actually feel. Palpitations in Chinese medicine encompasses everything from being aware that the heartbeat is slightly more pronounced and is noticeable on the one hand to outright disorders such as atrial fibrillation on the other. It is important to be conscious of this when interviewing a client because many patients have a sensation of their heartbeat sometimes being slightly stronger without them thinking of this as being palpitations. This is nevertheless an indication that there is a heart imbalance in Chinese medicine, and it is an important sign. Cold can also affect the heart. The heart as an organ cannot be directly invaded by exogenous cold. Exogenous cold can, however, stagnate heart blood, and cold can therefore be a factor when there are heart blood stagnation patterns. Yang deficiency conditions can also result in the heart not performing its functions optimally. Like most heart imbalances, heart yang deficiency can manifest with palpitations, where palpitations in heat imbalances are the result of the heart qi being agitated and overactivated. Palpitations that are due to heart yang deficiency will be the result of heart yang losing control of the rhythmical pumping action of the heart. This is the same mechanism that results in palpitations when there is heart qi deficiency. Heart blood and heart yin should anchor the heart's yang aspects, which include heart yang, qi, and shen. If there is heart yin deficiency or heart blood deficiency, they will not be able to anchor these yang aspects. This can again result in palpitations due to the heart no longer being able to control its rhythmic pumping. But this time, there will also be a slight emotional unrest or anxiety that manifests concurrently with the palpitations due to the shen not being anchored. If there is a significant disruption of the physical functioning of the heart, such as when there is heart blood stagnation, there will not only be disruption of the rhythm and strength of the heartbeat, but there will also be cardiac pain or pain in the thoracic region. The pain will be a fixed stabbing or piercing pain. If there is chi stagnation, there will not be the same sensation of pain, but more of a sensation of chest oppression and tightness. It will feel as if there is an iron rim or a strong elastic stretched around the chest. Phlegm stagnation will manifest with a similar but different sensation. There will again be chest oppression, but phlegm will manifest with a heavy black sensation in the chest as if there is a great weight, such as a rock lying on top of the thorax. Because the heart and the lung have a very close relationship, a disturbance of the heart qi will also manifest with the breathing being affected. Similarly, zong qi helps to drive blood through the vessels. If there is dysfunction in the heart or if zong qi is weak or stagnated, blood will not reach out to the extremities. This can manifest in white, cold fingers and toes. This is typically seen when there is heart qi deficiency and heart yang deficiency. Purple fingernails are seen in conditions where there is blood stagnation, including heart blood stagnation. Shen encompasses the Western concepts of the mind and consciousness. When there are heart imbalances, they will nearly always manifest with changes in the person's Shen, which can be anything from almost unperceivable, subtle changes to severe personality disorders. Shen is nourished and anchored by heart yin and heart blood. If these are weak, Shen will lack nourishment and rooting. The person will be easily startled and unsettled due to their Shen lacking stability. Often, the lack of anchoring will also cause the person to have difficulty sleeping or be nervous, uneasy, and restless. This will be more extreme if there is heat due to yin deficiency. The agitation and restlessness will not only be mental, but it will also manifest physically with the person fidgeting and having nervous movements, especially when they are uneasy. Shen is, in general, very sensitive to heat. Excess heat, in particular, agitates the Shen. When the Shen is agitated, the person will be mentally restless and feel uneasy. Their Shen becomes too active. The difference between deficient and excess heat will often be seen in the intensity and severity of these manifestations. If there is excess heat, the person will seem to be more stressed, their mental unrest will be more pronounced, and they will be more irritable. If the heat is intense, there will not only be mental unrest, but also actual mania. Thank you so much for listening.